Hello, this is Dr. Stephen Gradwell. I've got Dr. Amy Bates with me here today, and today we're going to talk about shoulder problems. Most of the time when people think about back pain and neck pain, they think about chiropractic, but they forget that we do a lot of work with shoulder problems, and one of the most sneaky problems that we find is the biceps tendon. And the biceps tendon can actually subluxate out of the groove. So what we're going to talk about first is how you might know if you might have a problem there. One of the most common things that we'll see in the biceps tendon, first of all, the biceps tendon is going to be right here on the anterior part of the shoulder, right in this area here. And let's take a look at the anatomy here. I'm going to bring this up. The biceps tendon is right in this area here. You can see this our little model has this little, looks like a little elastic band here, and that represents the biceps tendon. And the biceps is because there's two bellies of that muscle. So it attaches down here in the forearm. I'm going to use the clavicle to point down. It attaches down in here, and then it comes up in here, and this is the long head that actually goes up into the back of the scapula there, and then the other head that goes here. We're going to be interested in the biceps tendon. Now, how you might notice that you have a problem with that is you might have been swinging a bat and swinging for the bleachers, and that can cause that biceps to pop out of that groove. Or maybe playing tennis and you're swinging back and you feel it. And what you might notice is that you get pain with that. What you might notice if you just do this at home is you can put your arm over the shoulder just like Dr. Bates is doing here, and then just bring that elbow up vertical or up in the plane right here in that sagittal plane. And what will happen is you might have pain right in this area here. Or show us how, we had a patient earlier that did it wrong. Show us how they did it earlier. This is one of our patients that Dr. Bates saw earlier today. She was doing it this way. And what we came to find out with examination is that biceps tendon had come out of the groove. So you might have pain in this motion. You might have pain when you go like this. You might notice that when you reach around to scratch the back, we call this the Apley scratch test. You scratch that, it feels painful right in that area. That's a sign that that tissue is impinging. And what can happen is that biceps tendon, this is the left shoulder. We've been looking at the right one here, but on the left shoulder, what we can do is you can see this little groove, and the tendon lays right in that groove. And what can happen is that biceps long head tendon can get right up on that lip. And when it does, then all the muscles go, oh my goodness, what's happening? And so you might find that you have no strength in this motion. So you push up against it and it just goes out. That's a sign that you've got a biceps tendon subluxation. And what we do as practitioners is we first localize that. Then we figure out what muscle is overworking. Because usually when that happens, there's a muscle that's overworking. Many times the pec minor, which is right in here, will overwork. Dr. Bates found one, the supraspinatus, right, earlier today?
Pec minor and then
levator. Okay. So you can have other muscles overworking for it. It's like a dysfunctional marriage or dysfunctional relationship. So these muscles overwork, that underworks, and it just keeps the problem going. And then eventually these muscles, even in the back of the shoulder, on the back side, are like, well, let's help too. And so they start tightening up, and then we lose range of motion. This is why this is one of the sneakiest little problems, because it can be present and the patient begins to have pain here, or they feel pain here, or they feel pain here, and they're not certain what's going on. So if you notice that you get pain with like a tennis move, or you're trying to do your hair and you feel pain here, or you bring your arm like this, there's a possibility that that impingement that's going on there is coming from the biceps tendon. And a chiropractic evaluation, utilizing neurokinetic principles, we can figure out where that is, who the dominant in the dysfunctional relationship is, bring those down, relocate the tendon, and then reactivate the muscles so that you can gain back your tennis, your baseball, you're even doing your hair, okay? And get the strength back in that shoulder and get the pain out. I hope you enjoyed the video.